Good. So thanks for having you guys once again. We intend to have spare me. LO4, and that's the structure and overview of the health and social care sector, Unit 1. But then we're going to look into learning outcome 4, understanding the issues within the health and social care. If I may ask, for those of you who are carers, what are some of the underlying issues that you found within the healthcare sector that you think is of concern? What issues have you guys identified that you think is of interest? So one of those issues we could look into will be the causes of inequalities. Okay, health inequalities, the differences within the healthcare sector. Okay, whether people in the lower socioeconomic groups are more likely to experience poor healthcare. Of course, there are instances where people will need to be treated beyond just the NHS or the fundamental or the primary healthcare that is given by government. There are situations where you need to sort of explore or specialized treatment or surgery that requires extra money from you. And those brackets of people, so to speak, people with lower income may have some difficulties to be able to access those kind of healthcare. Okay, so health inequalities are often observed along social gradient. It means that the more favorable the socioeconomic circumstances, such as income or education, the better your chance of enjoying good health and longer life. These conditions are known as social determinants of health. And the primary causes of health inequality are complex. They do not arise by chance. Ultimately, the root causes of health inequalities, they may be cultural barriers, okay? You may have general socioeconomic barriers. You may have social and community networks. You may have issues of inequality in terms of age, sex, and, constitution factors. So there are many factors that really affects health inequalities. Okay. May I ask, how would cultural barriers be pose an hindrance to healthcare inequalities? Can anybody answer that? How could cultural be a challenge for healthcare? Cultural. Are we together? I'm asking a question. I'm saying, how could cultural barriers become a challenge to healthcare inequalities?
Sorry, good afternoon.
After.
I just want to just maybe my own experience working as a carer.
Go ahead.
There's a services I worked with sometimes ago, but due to my color, this happened to me. Due to my color, it was like he doesn't trust anybody with from African descent that they can be so corrupt, like But I see that as I raise a safeguard so concerning that, because you just like making you feel low of yourself coming from Africa, that it doesn't work like working with sorry, like working with black descendants, which is a kind of challenge, and I feel unsafe at that moment. So that really prompted me to say this to my line manager about that, which they have to raise a concern concerning that. So I think that really dealt with my mental health those periods. So I will have to even take a day off from work because of that. So I think that's one of the challenges I face working as a care worker.
Amazing. That's a very solid example. Do we have any others who want to contribute? Please.
Hello. I think it might be sometimes accent because of skin color. Sometimes yes, fine, but when it comes to you speaking, sometimes they have different accents. Maybe someone comes from Liverpool, someone comes from Scotland. The way you speak is quite different, and when you're speaking, sometimes they don't tend to understand you, and you don't understand them. That creates a barrier. Sometimes I remember, like when I first started in healthcare, I had an issue whereby I was talking to this Liverpool man. It was my first day on shift. And he was speaking. And, I didn't want to say, there's something I've learned is don't assume. Even if they're going to laugh at you, please ask a question. There's no stupid question. So I said, oh, what did you say? Is I laughing? I said, oh, she never understands me. Oh, fucking idiot. He called me that. And I told him, I said, don't disrespect me. I'm only asking what you want. And I moved off. And he got upset because I moved off. And he reported me. So when I got called in, I said, there's something I would not take from a service user, and that's disrespect. And I said, for me not to further trigger him, that was why I had to disengage.
True.
That was the right thing to do.
True.
And sometimes I think we also as Black people, we make mistakes.
Okay.
Because we don't want to look stupid. We do the wrong things. They might ask us something, and because we don't want to look stupid, we go ahead and do something else. And when we come back now, that is when we look more stupid. And, me moving from being a support worker to a senior support worker, it wasn't so tough for me to navigate because sometimes I do a lot of listening rather than talking.
Amazing.
It has really helped me. And after that, I migrated, like I switched job roles. And I tell people, I say, it's not only in support you can get, a career. You can switch job roles. I just recently switched to activity coordinator. That was sometime last year, and I just finished my probationary period. And I found it interesting because you've been on the support level. It makes you just, all you do is observations, you do care plans, you do all that. But when you're working on a different role, it makes you really know the service users because now you're working directly with them. And that was when I got to understand that sometimes it's not, it is, to me, I see it as ignorance. It's not that they don't want to communicate with you. They're just ignorant. Because it is something that has been in their history and you can't change it.
True.
In their head, they feel, oh, we Black people, we just came in here to take their jobs and all that. But it takes you to sit. And when someone disrespects you, I had to sit one of my co-workers. There was a time she was trying to be rude to me and all that. And I called her and said, look, from where I come from, we work hard to get what we want. And I said, for me to come into this country, I did not come here on a free visa. I paid to come into this country, and I'm going to make the best use of it. And I said, do you know how much my husband had to pay for his master's in this country? I said, do you think the house I live is for free? And when I started saying all these things, they became more enlightened because in their head, they just felt we all just came here, maybe on asylum or whatever. So sometimes it's not just the skin color. Sometimes it might be the approach. Sometimes even our body language, it goes a long way. Sometimes we're speaking to a service user, and because they've said something, your facial expression might switch. And they are reading that. And that triggers them. And you don't know. There were lots of things I had to learn on the job. And now I can move. In fact, I worked on a men medium secure for 2 good years. And I stayed on that ward for 2 good years because I didn't want to be that person that would always move from maybe CAMS to the women. I wanted to understand. And where I was working was a PD. I was working with the MIPD services. Like, I mean, the PD services, the autistic services, the learning disabilities, that was where I was working. So for me now to move to a low secure, it was just like, wait, what am I doing here? Because all I knew was restrictions. And that was when I got to know, oh, this is the difference between medium secure and this is low secure. The way they think in medium is quite different from the way they think in low secure. Now, the way you think as an activity coordinator is different from the way you would think as a senior support worker. So I'm just saying, sometimes, yes, our skin color might create barriers. Sometimes our accent creates barriers as well. It only takes you to know how to navigate.
Interesting. Wow. That's a detailed, clear example. And may I know the name? Is that Millie?
No, there's Elizabeth.
Elizabeth, that's fine.
Yes, thank you.
Amazing. Guys, Elizabeth has given us quite detailed, clear example or classic practical example from his workplace and all that, which is very, very important. The very things that impairs or impedes healthcare inequalities in the workplace is very, very critical, very, very critical. And do we have anything else somebody wants to add?
My name is Faith. I'd just like to share my experience. Mine is in the line of religion.
Religion, okay.
So we got this contract. My agency got this contract. It was an African family, and they were Muslim. They practice Muslim Islam. So I and my colleague were sent there to attend to the services. He's a male, and on getting there, and he saw both of us because he needed 2 carers, and he was like, "So what service do you offer?" And we read out everything that we asked to assist him with, and it was like, "Oh no, sorry, we won't be able to do that for him." And we asked why. He said he's a Muslim and he's a man, and because we're ladies, that he's not comfortable to get to undress before us. So we said, okay, that's fine. We'll just give the feedback back to the office and see what they can do about it. So we called the office and we reported the matter. And the service user was actually requesting for male carers. But at that point in time, we only had 1 male carer. And he was like, okay, if the male, my colleague who's the male could be sent, they could send him down. And they were like, no, the rota is on rotation. So you can't keep having that person every day because they need to rotate it. And you can imagine your service, you need your services from Monday to Sunday. You don't expect that person to work from Monday to Sunday. So it was something that they couldn't resolve. So that contract was terminated. Yeah.
Wow. These stuffs. Wow. So it's inequalities, they're quite massive and quite an increase within the health and social sector and other sectors. These are intriguing piece of information that I'm gathering from you guys. And now I would add
sorry, if you are gathering information, this one just something I want to put across. You know, we the Africans, we are our own enemies.
Who you speak? Is it Faustina?
Yes, please.
Okay.
I worked in a care home, and there's this African lady. I don't want to mention the country.
No, you don't need to. You don't need
And
to,
she was one with the white.
please.
When they are working, they ask the lady to monitor. Then she report to them, this carer is that, this is this, this is that, this is that. Then she writes report for them to be signed so that you can be sacked. That's a care home I worked.
Oh.
I'm telling you. In fact, a lot was going on. We couldn't report it. At a point in time, a lady was sacked, and the husband, she was given a query letter and later was sacked. And this lady just responded, received, and took the matter to a lawyer. So what the lawyer told the manager or the whatever, the owner, was that if she reports the lady to, or if her DBS is revoked or she reports her to CQC and whatever, they will make sure his home is locked or it's whatever. What word do I use?
We understand.
Yeah.
Understand.
So that was what ended the issue. But the lady was sacked. So if not for the lawyer's intervention, the lady's DBS could have been tampered with. She could have been reported to the police, taken to the bar, as you said yesterday. So it was a whole lot last year. But I will not mention the name of the care home.
You don't need to. You don't need to. These are just for lecture purposes, so we don't need you. May I ask on this platform, are you guys, how many of you are registered with unions? Have you registered with unions at all?
Yes.
Good. Who amongst you is not registered with the union?
Me. Me.
I'm not yet.
You can't hear me, you said.
It's me. I've not registered.
Why?
Now that I know, I will do so.
Is that Faustina?
Yes, please.
But Faustina, you can't be telling us this and with this example and you are not registered with a union.
I will do.
Yeah. And so some of you may have internal unions within your organizations. However, I recommend you register with Unison. Okay? Unison. It's a wing of the Labour Party. You know, it's a trade union that supports the Labour Party. So Unison or Royal College of Surgeons, Royal College of, nursing and midwifery. There's also a union that you can join as well. It is important that you register because there's so much inequalities and issues within the healthcare, and it's important that you enroll in those unions so that when such issues or allegations are made against you, they are able to defend you. Like in the case of a lawyer, I can imagine how much money your colleague would have paid to a lawyer to help in fighting the case for him or for her. However, if you were part of a union, you don't need to pay nothing. Do you understand me? Okay. If you are part of a union, you only pay your monthly subscription. It might even be £10 or even £20. If you're an employer, if you're a student, you pay about £10. And if you are a worker based on your salary per annum, you might even pay only £20. That's all. And when you have any issue, the union will fight for you. They won't take no money from you. This is why it's important you join a union. The union has legal teams that will fight for you, employment inequalities, unfair dismissal of staffs, allegations and unfair treatment, discriminatory issues, prejudice, victimizations, and all those things. The union would fight for you. So please join an union. Okay. Now, it is important that we understand that healthcare inequalities does not only find itself around the carers, but also the patient as well. So your explanations, what you guys have said, we've had issues of ASCENT, issues of unfair treatment and reportage and issues of cultural barriers and all that. But we must also understand that in as much as the carers would raise concerns of inequalities and discriminatories, either age, sex, orientations, and all that, the patients would also can raise issues against you, the carer, as well. You understand me? Okay? About the same inequality. So even though you might argue and say probably there's been a racist against you or you've been treated because of your color, the patient who might be a white or an Asian can also raise the same issue against you and say you're not treated because he's a white. And that's why we have to be very modest in our communications. Okay. Elizabeth spoke about accent. When you don't understand someone, you have the right to ask the person, I beg your pardon, can you repeat yourself again and again? Get it right. Don't feel shy. Don't feel because probably they might say you don't understand it. No, because we Africans even speak better English. We speak the Queen's English. And and the Queen's English normally is in London. Those who grew up in London, they speak exactly how Africans speak the Queen's English. I mean, but those who come from Liverpool, Scotland, Manchester, Mancunian, they have a different accent. And therefore, you might necessarily not grab when they are speaking, but it's within your rights and by law to ask even 20 times and re-echo and ask, could you please explain yourself again so you can get clear understanding? Because it could be used against you when somebody hates you for whatever reasons. In a form of abuse, when you study the types of abuse, there's a kind of abuse what we call hate. You understand? Hate abuse. Have you heard of it before? Just somebody hates you because of your color. You've not done anything wrong, okay? Because of your color, it's hate crime. They just hate you.
It happened to me.
That's fine, Francis. So it's those things are there. So you have to place yourself in a way that you don't fall victim to any of such. So it is important, and I said that yesterday, you need to cover your back. Anything that you do, write them down, document it in the communication book. Anything, including even your colleagues, you are working with them, because you never know, just as you have said, Francis, that Faustina, that sometimes we are own enemies among even the African or Caribbean environment. And so what will protect you is the documentation that you have done. If you have changed a part overnight, make sure you document it. Okay. If you have done some, make sure you document it. It will cover your back so that somebody goes and lie or phrase something about you, the document would sort of protect you. Ensure that for every documentation that you have done, if there's any space, rule a line and sign. Are we together? Okay. For any writings that you have done by the close of your work schedules or during the routines, make sure if there's any space beneath, you rule a line within that space and you sign so that nobody can put something in. Okay. It is also important that the carers that we care for, or the patient, or more to speak, the service users that we care for, we have to ensure that we've had their ultimate consent in what we do, and therefore, when consent are given, you document it as well so that nobody turns back and lie and say things about you. Okay. Now, cultural, whether we like it or not, of course, you may have certain cultures that may be, and one of the things that I realized within the healthcare is a lot of the services that we care of, most of them may be indigenous white people, and that we care for. And because sometimes it may seem that the Caribbean or the Afro-Caribbean environment, we may come across as aggressive, or probably a word to be used of shouting. If you realize, many of the times they say, are you shouting on me, or are you threatening me, or are you being aggressive? It may not that you're not being aggressive, but many of the culture, because we may come across as loud, that we don't even realize that we are loud. And so many of these situation can be used against you and said, he shouted on me or she shouted on me or she was very aggressive towards me. And for that reason, I don't want to work with her as a carer anymore. And probably the person might be wrong, but because you became aggressive. So for whatever situation that you go yourself, do not be aggressive. Okay, even if the person is lying on you, be not being aggressive, because rather it may be misconstrued. Okay, even though you may be right, but probably at the event when somebody appeared at the scene, you were being aggressive, or probably you were shouting, and they will say it confirms what the person was saying. It may be a lie. So I would advise that or admonish that no matter the situation that you find yourself, do not be aggressive. Do not scream and shout. Okay, those are some of the things that will be used against you as a carer. Okay, because the inequalities are much. So age, sex, the allegations of it is quite interesting. And Elizabeth was talking about a secured and low secured and high. It tells me that Elizabeth works within the mental health sector, because the things that she was saying is more to do with more a mental health and a secure unit, autism, learning disability, and all that. And at times with this mental health sector and the hospitals, you may be left one-on-one with a patient and nobody is there. Okay, one-on-one taking care of a patient, and we classify that as lone worker. Okay, or people have to travel far for what we call living care, and you live with the patient or a service user alone at home, and nobody is there. So it's your word against the person's word. Who is there to defend you? Are we together? Okay, who is there to defend you? And so the documentation part helps, and have it back of your mind that wherever you are doing, you can't be monitored. You can't be, there can maybe hidden cameras that you don't even know about. We've watched on BBCs where there have been abuse on care homes where there were cameras and African carers and non-African carers were not aware of, and all that. So you need to do the, however, make sure don't follow any friend who will tell you, let's do some shortcuts that may create problem for you, because you never know when those shortcuts, you can do that every time, but you never know when these shortcuts can create problem for you. You never know where there's a hidden camera somewhere. You don't know when somebody's going to betray you. But for me, what would justify most time is document them. Make sure you document. And if somebody says, in the care home, a colleague may say, oh, you do all the care runs and I'll do the documentations. We don't even check what they write, do we? You understand me? Okay. A colleague says, oh, let's do all the care, I'll do the writings. Or your senior say, I'll do all the writings. We don't even check the things they write. You need to be able to read what has been written. So make sure that whatever is written also covers you, that indeed you worked together. So these are some of the things that I want us to look into in our day-to-day activities in the workplaces. Now, how many of you have realized, which are those who have relocated to the UK in recent times, whenever you fill in a form, whether application form, hospital form, they normally ask you, you see something. What's the sexuality? Heterosexual, they want to know and all that. And they want to know what kind of ethnicity are you from? Have you realized that? They want to know British, white, and all that. That's something that most people will not take notice of. Normally, you see beneath it, you will see option, Black African, Black Caribbean, white, Asian, blah. And then you see something says, prefer not to say. Have you seen that?
Yeah.
Yes.
Prefer not to say. You see. So it's within your right, okay? If there's a collection of data and that could be used against you because they want to see how many Black people, African people live in a work in a care home or whatever, you have the right not to give out. You can say, the law allows you to say, prefer not to say, or prefer not to disclose who you are. So even if you're a Black African, you can choose not to state who you are, because the law allows you to say before. If you are a bisexual or you are a gay, it's not compulsory that you have to state you were gay. You can say prefer not to state, and the law supports it. So these are things that you guys have to learn. Okay, it's not compulsory that you have to state who you are, whether Black, African, your age factor. You have to give your age, whether 30, 35 years. It's not compulsory. You can decide to decline and say prefer not to stay there. So there are many things that we have to learn. But what I'm more concerned about is let's not appear aggressive. These are some of the things, it's a many things that runs around most Africans. Aggressive, loudness, and all that. No matter the situation that you find yourself, have it at the back of your mind, I'm not going to be aggressive. Okay? Because it's all about, like Elizabeth said, it's all about the body languages. They watch all these things. So you may be right. You may be right. It may be pure allegation against you, but your body language and how you come across will mess up everything, and it will be ruled against you. Okay? Now let's crack on. Today's lectures is more practical. I don't want to go into more of, I just want to be more practical as I can in today's lectures. Okay? Because inequality is a big thing within the health and social care sector. Okay. Now, so how do we obtain appointments in the UK? Okay. Most times you need to have a convenient time that could be difficult for some people who are worried about getting time off work. In the UK, appointment with the GP is quite difficult these days because there are some GPs as early as 9 a.m. If you call them, there won't be any appointments. Sometimes you need to call as my GP. If I don't call them around 8 a.m., I can't get any appointment with a doctor. I don't know about you. Okay. And even that 8 a.m., the line is so busy. so busy to be able to find your way out in trying to get an appointment to speak to a doctor. So these are all forms of situations that helps against inequality. Okay. So if you realize they've done or they've created opportunities for walk-ins, because of how difficult it is sometimes for people to sort of have appointment with their GP. So sometimes if you call them, there are evening walk-ins and weekend walk-ins that you could find close to your near place of abode or locations that you can tap in for various situations or ailments. Okay, getting to the appointment. Those who rely on public transport may find access more difficult. Of course, it's true, especially for those in rural areas, low income, and for those with mobility issues. Of course, if you have mobility issues and you don't drive, it will be very difficult to be able to. And even during snowy time, snow and it's raining, and you're going to public transport, it's very difficult getting to your place of appointments. But then we can address this by new technologies that have been enabled, new types of appointments such as video consultations, online consultations. Of course, these days the doctors will call you and have some phone conversation with you, and then they will recommend medication or prescribe medications for you. Okay.
Just to say something,
Right.
I think yours is quite different because the GP I use for my family and my kids is quite different. So they've stopped phone calls.
Have they?
So what you do is you go to the website, then it shows a place that you need to book an appointment. So it's write new appointment, then you book it. So it depends on the answers you give before they get to put you. Maybe it's a triage, or maybe they have to tell you to come back or something. So
Okay.
I tried it several times and I realized that they just tell you, oh, go to the pharmacy. So I think in this country, sometimes they really want to, like they want it to be really serious before they can attend to you. But as an African mother than I am everything I take is serious when it comes to my kids. So even if it's maybe my child is throwing up at school, they always say, oh, the child has caught a bug or something. I would buttress the explanation there. So by the time they're going to give me a time, I have never missed an appointment for that same day that I book an appointment. It depends on how well you explain and I think the descriptive language you use sometimes that makes them pick it up.
Good, but I'm sure many GPs probably may not have yes, there's a bit of technology going on that many
Yeah,
could.
exactly.
I'm sure
That's what I'm just saying. quite different
A
from
lot of
yours,
them, yeah,
but
yeah.
that's the phone call, yeah.
It's quite different from mini GP. I mean, it differs from each other. However, I think a lot more have adapted a situation where they could reach out to people on doctor's appointment. I'm sure many of you be experiencing that, where doctors will call you to speak with you, and then if they feel your ailment or your sickness is quite serious, then probably they would request you to come in or refer you to an hospital for you to attend. But for basic ailments and all that, they normally call you and listen to you, ascertain what is happening to you, and then refer you to or prescribe a medicine for you to pick up from the pharmacy and all that. Yes, and exactly rightly so what you've said. Sometimes some will have to go online and book, or put in those descriptive information there for them to then arrange for a doctor's call. But my GP, I'm sure you have to call them in the morning, and then as early as 8 o'clock or 9 a.m. And then if they have a doctor's appointment, they will book you for a doctor to call you on a phone call. And if they don't have, you need to go to your nearest A&E, or sometimes you can go into what we call walk-in, without with the children, walk-in services. And they will tell you normally the walk-in service, you have to go to the nearest ones for you to attend as well. So, but now, we've mentioned about the general practice interactions. It's one of the things that we mentioned. It's a communication between service users and healthcare professionals can sometimes be difficult to language. Disability of cultural differences, aging, visually impaired patients, autistic people, or those who have learning disabilities may need longer appointments or wish to attend during the time of the day when the waiting area is quite short. Of course, if you go to an A&E now, during the weekends, the place may be more quieter, than probably during the weekdays, or whether during the weekdays it's more busier and all the weekends are more busier. So there are timings where the booking system may be quite on a minimal. And there are times I don't love going to A&E because I feel you might one day die before they even attend to you. Okay. Because no matter how severe your ailment may be, you have to follow routines. Okay. You have to, because there are many people before you, and therefore they have to attend to all of them before it gets to you. So I don't love going to A&E because the waiting time is too long. These are the reasons why the healthcare visas were introduced. So you can have a lot of healthcare professionals and also nurses to come into the UK and work with the NHS, because the demand is quite huge, but few staffs are made available. And it says that this can be addressed by cultural competency training, which covers areas like dressing, custom behaviors, language, religious beliefs, worldviews, kinships, relationships. Yeah, it's important that we have to ensure that for those of us who take care of patients, you need to ask people their choices. It helps because if you don't know it, you present a food to a Muslim person or a Jew person or the Hindu, and without not asking the Muslim who they are and to know that food is halal, you find yourself in a problem. And so it is important that you interact, the choices that the kind of what they want. Okay, you may have a name. Not every name may sound a Muslim name, but they may be Muslim. It's not everybody who is called Ali or Muhammad or Kasim, it's not everyone that you can easily depict the names as Muslim that you can tell there's a Muslim. You cannot. Okay, or dress in a Muslim outfit that you can tell. But per interaction, you will know who the person is, and then it informs you the kind of food that you have to give them, because they eat halal food, and in the hospitals they are halal food prepared for Muslims and all that. And some may have strong cultural beliefs that it is important, okay, that you need to know them, so you could administer a better care package for them, one as a carer or one as a company. Okay, very, very important. Okay, do you have any questions at this stage? Okay, let's crack on. Public health has been identified as the science and act of preventing diseases, prolonging life and improving quality of life through organized efforts and informed choices of society, organizations, public and private communities, and individuals. Therefore, analyzing the determinants of health of a population and the threats it faces is the basis for public health. The public can be as small as a handful of people or as large as village or entire city. In the case of a pandemic, which in the case of COVID-19 or flu, it may encompass several continents. The concept of health takes into account physical, psychological, and social well-being. Awesome. It's very key. Okay. So public health, which seeks to address all ailment publicly. Okay. And for example, COVID-19, which was worldwide. Okay. Public health, what it does, every country has its own public health. So you may have in Nigeria or Ghana Ministry of Health, or you may have the NHSIS in the case of Ghana. Okay, so what public health does that they come out with policies and methodologies or preventive measures against outbreaks of diseases that confronts a country or a nation or a community. Okay, and it's important that in doing that, you ensure that you are able to cover all the facets of the healthcare chain, the age factor, the sexuality factor, those who are older, because the older generation are more prone to sickness. So if you realize that the COVID-19, when it happened in the UK, more older people died because the immune system are quite weak. And so a little thing that strikes them, asthmatic and all those things, they die quickly. So more older people died. And public health would have to address these things so there's the fairness and equity across the board and there's no inequality in that situation. Okay. Now, vaccination programs. Vaccination is the administration of vaccine to help immune system develop protection from a disease. Vaccines contain a microorganism or virus in a weakened life or skill state, or proteins or toxins from the organism in stimulating the body's adaptive immunity. They help prevent sickness from an infectious disease. Very, very important. So vaccination, love, if you've not had your vaccinations, you need to have them every now and then. You need to regularly check your GP profile or file, whether online or print out, and it tells you where you are due for certain vaccinations, okay? Chickenpox, MMR, varicella, rubella, all those. And even if you are traveling out of the UK, you need to check with your GP what kind of vaccination that you need to have when you have to travel. There's something called booster. Sometimes your GP necessarily may not be able to give you all the vaccination, but you could also try what we call travel clinics. These are private travel clinics that you can attend. One of them is Nomadics Travel Clinic. You can attend and pay money. They can give you those injections, especially for those who intend working in the hospitals or NHS. They will need to have your immunization need to be intact. The care homes don't do that. The care homes are not too bothered about your immunizations and all that, but the NHS or the hospitals,
The care homes do.
They do these
They
days,
do.
right?
Yeah.
Amazing. But the hospitals are very rigorous. In fact, they want to see sometimes, because you're going to be prone to blood and all those things, they want to see HIV, and all those things. They want to have record of all those HIV tests and all those things. So that shows that you are negative or positive. All right. Okay. So tuberculosis, coronavirus, recent times, you are much aware that there's a huge flu affecting lots of people, isn't it? The flu is all over. Even those of us who've had the flu jab, we're still getting the flu. So I don't know what's happening in the UK. Okay. So they are preventive vaccination program, but you need to have them. You need to check every now and then with your GP. If you had some vaccinations expires, it may be 1 year, it may be 2 years, and your GP would normally text you or remind you to come for a re-vaccination. Okay, very, very important. All right. Do you have any questions at all? Contraceptions. Okay, let's look at contraceptions. So it deals with the birth control, also known as contraception, anti-conceptions, fertility control. It's a method or device used to prevent pregnancy. Birth control has been used since ancient times, but effective and safe methods of birth control only become available in the 20th century. Contraception is one of the core public health issues. Very key. It has the potential to reduce family size. Oh, that's true. And improve birth spacing, which in turn leads to better health outcomes for infants, children, or women. One of the most we can talk about family planning and all those things, can't we? All right. So Public Health England encourages organizations and individuals to use the Eat Well guide to make sure everyone receives consistent messages about the balance of foods in healthcare. Very important. It is recorded that there's huge increase, or the percentage of obesity among African community is huge. Okay, research has proven. It means that our Eat Well guide, we don't really practice an Eat Well guide system. It's researched. It's just a huge obesity, and that leads to high hypertension among the African Caribbean community. You see, we are used to more of the starchy foods and all that, and therefore we are not able to balance very well, or do a bit of workout to ensure that we are able to reduce the obesity that comes. Normally, when you are growing old, you put on weight and all that. So it is important you check and most of the times it's not the starchy food, it's also the end products. Okay, the sugary that turns into starchy fast and all that. It's very important that we look into our eating pattern. And for those of us who work nights, you might not realize that, because at night with cup of tea, toasted bread, cup of tea, toast bread, cup of tea, toast bread, you are eating very late. You take some rice to the workplace to eat some egusi and ebono, you understand, and all that, so you eat very late and it becomes a continuous routine pattern because you work at night, you're always eating at late. This encourages obesity and it creates more ailments in your body system. Okay, that leads to heart failures, lungs issues, and all that. Okay, it's very important we take notes of that. I've just mentioned that there are many current issues in the provision, issues like obesity, one of the key things, and it's normally huge among the African community, also in the white community, but it's quite huge within the African. A lot of people are obese in this country because we don't check our eating patterns, or the timings of eating are so late that the digestive system that is not able to digest the food properly and all that. Okay, diabetes is also one of the key things. Okay, sugary stuffs and all that, we are not able to check sugary stuff. Coronavirus, we know about. Heart diseases, we know about. An increasing aging population. Of course, once you're growing older, your immune system are also growing older. So you need to have medication that keeps the immune system intact. Okay. So the health survey for England 2019 estimates that about 28.0% of adults in England are obese. And a further 36.2% are overweight, but not obese. So there's an obesity and there's overweight. Obesity is extreme, okay? You will have putting on more weight. If you know you weigh 70 and then you've gone beyond 70, 79, or you are overweight, but you might not be obese. But obesity is extreme. Okay, obesity is usually defined as having a body index, BMI. Normally, they can do that with your GP. You can always ask them for your BMI. This is your age divided by your weight. And then if it's more, when you do the subtraction. Can we mute ourselves? Can we mute ourselves, please? Is that Faustina? Can we mute ourselves, please? All right. So when they do the deduction, they can tell that, oh, your body image is clearly overweight. Obesity has taken place because you normally would do the BMI between your ages and your weight, and then when they do the calculations, they can tell that you are overweight, you are an obesity, or you are obese. Okay, yeah, in that regard, the survey found out that men are more likely than women to be overweight or obese. Okay? 68.2% of men or 60.4% of women. So more people aged between 45 to 74 are more likely, yes, because you are growing during that age. So the body is coming weak. The stuff that holds the body is becoming weak. So you need to be more careful about your health and what you eat. Okay? Okay. What you eat. The Bible says, what a man eats does not define, but what comes out of him. So giggle in, giggle out. Okay? It's the garbage you put in, out in the garbage that will come out. So it's what we feed the body system that will ensure the outward display of the body system. Okay, so when you are eating anyhow and you're not checking, you're just not going to be obese because you're going to protrude stomach and all those things. Very, very important. Okay. Then we have to look in the childhood obesity in England. About 9.9% of reception age children aged 2 to 45 are obese. Oh my God. With a further 30.1% overweight. At age 10 to 11, year 6, 21.0% are obese and 40.1% overweight. This data is gathered as part of the National Child Measurement Program. Of course, the children as well, we need to guide them in their eating patterns. It's not that the child, because the child, so everything that he wants you give to and feed them, even late evenings, children are children. Sometimes they are crying and you are frustrated, they are disturbing you, and you allow them to eat anything that you have. You have to check and make sure that we are balancing their eating patterns and making sure that the timings of eating are also taken good care of. Okay, then let's look at diabetes. Around 90% of people with the diabetes have type 2. So we have type 1 and type 2 diabetes. Okay, the ones you see them using the what do you call it? The one with the pin that you press it at the hand and take the blood. You understand? So that's what we call type 2 diabetes. Around 80% of people with diabetes have type 1 diabetes. But about 2% of people with diabetes have rare types of diabetes. Okay, so type 2 is very serious. You always have to have some kind of sugary in your body. Okay, it's very, very serious. More than 4.9 people in the UK have diabetes. Very, very high. 30.6 million people have now increased risk of type 2 diabetes in the UK. You're most at risk of type 2 diabetes if you have a close family member who has diabetes, of course. That's why the doctors will always ask you, do you have somebody who have diabetes or have asthmatic patients in your family? 850,000 people are currently lying with type 2 diabetes, but are yet to be diagnosed. Research has consistently shown that for some people, combined lifestyle interventions, including diet, physical activity, very important, sustained weight loss, can be an effective way of reducing type 2, of course, because what we eat, the starchy food that we eat, the end product is glucose, which is more to do with sugary kind of. So if we don't build a healthy lifestyle in making sure that this thing turns to sweat and come out of our body, it gets stuck within the abdomen and all those places, and it end up giving us diabetes. Okay, so it is very important that we take good care of that and take note of this. Okay, then we have to look into heart diseases. Okay, we can talk about hypertension, high cholesterol, and all those things. They are all geared toward the same thing. Okay, once you have diabetes, most likely to have heart diseases as well. The heart disease is often interchangeably within the term cardiovascular disease. Okay, cardiovascular disease. Yeah, this heart disease generally refers to conditions that involve narrowed or blocked blood vessels that can lead to heart attack or chest pain or stroke. Very, very important. What you may say, high cholesterol. Heart and circulatory disease can cause around a quarter of all deaths in the UK. That's more than 160,000 deaths each year. An average of 460 deaths each day or every 3 minutes in the UK. This is very serious. There are around 7.6 million people living with heart or circulatory disease. So when your bloodstream, are blocked, it's very dangerous. You have regular stiffness of leg. If you're somebody who have regular stiffness of leg or hand, it means that your blood system is blocked. It's not being fragile. The blood flow are not flowing well, okay? And you need to look into it as soon as possible. All right, very, very important. In the UK, there are more than 100,000 hospitals admissions each year due to heart attacks. That's 1 minute. It's serious. And this is also very popular within the African Caribbean environment, okay? Aging factor, I've always played. I said aging, our body system, and when you exceed 40 for the first time, by 2040, nearly 1 in 7 people is projected to be aged over 75. Of course, aging is a contributing factor because once you are growing older, your body system are growing weak. Okay, so you need to have a conscious focus in ensuring that you bring your body system to speed, okay, with all the medications and all treatment, so your body does not get exposed to sicknesses and all that, and that will thereby affect you. Okay, so age is a without significant improvement in health, UK population aging will increase the amount of ill health and disability. Chronic conditions, multi-mobilities, and cognitive impairments will become more common. At the same time, families will face increasingly pressure to balance care with other responsibilities, of course, because when you're a mother, you have 3, 4 children, you are going to work, you are busy, sometimes you don't even have time for yourself and take good care of yourself and all that. But from work to children, from work, every now and then, it's important that you check your health. Go for regular checkups. It's free of charge with your hospital, your GPs. Regular checkup with yourself. It's something about your children. Call the GP, book an appointment, let them do scans and reviews so you can tell. Do not sit down. Do regular checkups because that would tell if there's something happening within your body system that you're not aware of. Okay? Coronavirus, we all know about that. What happened in COVID, how many people died, the virus, the impact of COVID-19 pandemic and wider impacts on local system, for example, schools. We all know how massive the effect of coronavirus, okay? There are many campaigns that addresses current public health issues within the UK. Okay, we have Change for Life Group. This is a government initiative that aims to improve diet and fitness level amongst the UK population. Well, the National Flu Immunizations Program 2021-2022 in its reviewing because we are in 2024 now. Influenza vaccinations, flu jab, that is given freely your GPs free of charge. You call and then you go for the jab free. You don't pay nothing. COVID-19 vaccination programs, ongoing mass immunization campaign for coronavirus between 2019 during the COVID-19 pandemic in the United Kingdom. Okay, so there were so many kits. You still have them there. COVID-19 kit that can be posted to you. You can do checks and tell for yourself what is happening to you. Okay. The Change for Life, each will move more and live longer. These are campaigns supported by the Department of Health. Okay, and intends to target a growing problem of obesity in a very hands-on, positive way, by instilling health, eating, and exercise habits into people from young age. The idea is that good eating habits formed early on life and will be carried forward into adulthood. The campaign slogan is "Eat well, move more." In other words, exercise more, walk more, or live longer. Okay, a simple message that has been designed to create a holistic approach to weight and health problems. It aims to encourage individuals to address all areas of their lifestyle with regards to safeguarding their future health and well-being and that of their children. Very, very important. Okay, so these are campaigns that you can get on. It all talks about eat well and then don't sleep, don't eat and go to bed, but then walk around, move around, and that in effect allows you to live longer. Okay. The National Flu Immunization Program. Influenza vaccines, also known as flu shots or flu jabs, are vaccines that protect against infection by influenza viruses. Influenza viruses are contagious, they are transferable. So saying somebody sneezes, even when your child goes to school and they get it, I tell you, within a week or two, everybody in your home is going to get it because it's about sneezing. It's transferable diseases as well. So you can imagine as an older person in your home, if you have a grandparent or your dad or mom living with you, because their body system are weak, that flu may weaken them more. That can even lead to death. Okay. So it is important that new versions of vaccines are developed twice a year as the influenza virus rapidly changes. While their effectiveness from year to year, most provide modest to high protein against influenza. Influenza workers who do not catch the flu will tend to work half a day sooner on average. Vaccine effectiveness in those over 65 years old remains uncertain due to
your main light off
and lack of high quality
turn it
research.
off.
Vaccination children may protect those around them. So it talks about the importance of having preventive vaccines, injections every now and then, because if you are just around beyond 40s and all that, your body system may not be able to adjust quickly. And it's important you do these things on a regular basis. Okay. The COVID-19 vaccinations we know about, and I wouldn't waste much time on that. We know what it entails, and as a result, the feedbacks that was gotten from the COVID-19 pandemic in the UK, whether you find yourself in Nigeria or Ghana. The UK vaccination rollout was the world's first mass immunization program for the disease when it began on 8 December 2022, after Margaret Keenan received a first dose of 2. As of 12 September, not everybody took the COVID-19 vaccination. Not everyone did. Some declined. There was so much hula baloo about the COVID-19. Others said they were going to kill people. It was created to kill people. It was created to reduce the number of people on earth. There was so many hula baloo about these vaccinations. So not everybody took the vaccine. But it was important that it was killing people, and therefore you have to ensure that you have those vaccines every now and then, you know, if it's still available, against any unforeseen sickness and ailment that
My picture.
we will bring our
Oh,
lectures
and I'll
to
just
an
make
end
sure
today.
I promise.
Can we unmute ourselves, please? Can we unmute ourselves? We are 17 in number. Okay. Can we unmute ourselves? And so the preliminary, we were able to look into equality of access to health and social care within your chosen country.
Okay, all right, guys.
We were able to look into the current public health issues.
No, you know when you wash it out. Yeah.
Noel, can you unmute yourself, please?
It's not Noel. It's not Noel. I'm on mute, please.
Are you? Okay. Okay. Then we have current public health issue within your chosen country. We were able to, and when we say chosen country, I would recommend that if you are doing your assignment, look into UK as a chosen country. It's more better for you because you are in the UK. Okay. And current issues in the provision of health and social care within, okay, and then campaigns to address current public health issues. I mentioned the Change for Life campaigns and all that. There are a lot of them, that there are a lot of campaigns around that ensures and address the public health issues within. We know the issues that confronts. We spoke about cultural issues, we spoke about accent issues, we spoke about age factor, sometimes your sexuality, whether you're gay, bisexual, you know, those may be factors that people may not even want to associate yourself. You know, you may have certain ailment, it may be HIV. And you know, whether we like or not, we are human beings. When you are in a hospital or you work in a care home and they say somebody has HIV, I'm telling you, let's be realistic with ourselves. People have their mindset. They are even sometimes they don't want to even come to your place and administer medications and all that. You know, people have certain mentality, and therefore, and they are scared that they will have transferable, but it doesn't work that way because it's more sexually transmitted rather than, you know, hand contact and all that. So there are many factors that affect the healthcare provision within our chosen country. Okay, so I want us to take key notes of that. And if the student model, you're going to see a lot of references from NHS England, obesity statistics, diabetes statistics, future of an aging population, the national flu immunization programs, the Change for Life, which you are aware of. So, and other relevant information. Don't forget that references are very key. Should you get any information from any of this, you need to reference, okay, that the information that you had, they are not your own. And therefore, you have to cite where you got that information from. Very, 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 very important. Okay. And so in general, we can say that there are inequalities in both sides, inequality or unfair treatment against staffs. And there could be unfair treatment against the service users as well, because staffs can abuse service users. Okay. As well, and that is why DBS played a major role, because there should be a DBS about you, the staff, to ensure that you don't have any safeguarding issues before you are being sent to take off a patient. Most especially if you're a lone worker. Lone workers are people who work alone, one-on-one with patients without nobody supervising them. So like living care, you travel, go to London, and you are staying with your clients alone in their homes. You may have once in a while their children coming over as next of kin. You are the one doing all the shopping, taking care of them, helping them with their movement, cooking for them, providing food and all that. Imagine if you have discrimination issues against the patient or the patient. These are huge concerns. But what may protect you is to ensure that you do and work to confirm what you have been trained for. Okay, you do your things accordingly and not do things anyhow. You do things, sometimes we become very relaxed because we do things a certain way, and for a long time we are used to. Until an issue happens, you wouldn't know. Okay, you wouldn't know. So allegations of sleeping on duty is one of it. It's an allegation of using your mobile phone at work. If you're a lone worker and you're not on break and you're continuously stealing your mobile phone and talking on the phone, it will catch up with you, because there may be cameras that you may not know. And it is not right to be using your phones. Sometimes the services said that we think that they have mental health issues, or they are related. They are the ones who report us. We think that they don't see what's going on. It is the patients who have been reporting us. They are the patients who report you as a carer and tell their father, their mother, or their next of kin that you are not aware of. And that can lead to many other things. There have been allegations against carers of rape, which may not be true, but allegations. Why? A patient is a mental health patient. He has an issue. They know that the mindset is not stable. They know is not sound in his thinking. However, once she makes an allegation and says, and Mr. Bilson or Mr. Daniel kissed me or gave me a peck, they don't care whether she's a mental health patient. They will investigate. It's a problem. Even though they know, you would reason, or you would have thought, or it stands to reason that a patient is a mental health patient. So if you say something, they shouldn't take her serious or take her serious. But once he makes an allegation against you that you kicked there, or you peck, or you hugged, or you touch a private part of her, it's a problem. They would have to do a thorough investigation about you, and that can lead to many other things. So we have to be very careful. And as far as we talk about discrimination against us, we also have to be very careful how we care about our normal duties in the area of inequality. Okay, how we provide the healthcare that we are fair. We are very fair in our judgments, in our treatments, very, very fair. Do not get annoyed. Do not use words like jaw, jaw, and all those things, because you are tired of yeah. If you feel you work in a place and the place you feel uncomfortable, raise concern with your line manager. They may be able to change you. Okay, they may be able to change you as well. And if the agency work, you can withdraw. It's a permanent work. They can change you to another place. They can swap you to another place. If you feel uncomfortable, you feel your health and safety is paramount to what is happening. Okay. All right, guys, I'll bring our lectures to an end. Do we have any questions at all? Do we have any questions?
No.
Ms. Elizabeth,
Yes, please.
No question.
are we sure?
No question.
Any contributions? Any contributions at all?
Well, I would just like to contribute as part of my experiences.
Okay.
Whatever you do, don't forget documentation is really key.
Good.
No matter how small it is, even if it's a dispute with your coworker or something, put an email through. If you've been treated unfairly, send an email. Copy your line manager, copy your manager in it. This goes a long way because it's more like a build up of evidence. Because when anything comes up, you can be able to pull out these receipts and say, this is it. And always during your clinical line management, your supervision, all that, just say things. But then again, always remember there's no safe space. So even if the company says, oh, it's a safe space, you can talk to us and all that. Just be mindful of the information you're giving. That's all I'll say.
Wonderful. Wonderful. Any other contributions, please?
It's same to that anyway. Just be in everything you are doing, just document your stuff, because there's a day it happens to me. Service user said I didn't return a change, which I did. But thank God I put it in record in the money handling form, and I have my own receipt duplicate. That really saved me, because I don't know what will happen. And even my manager was line manager was so impressed, like, oh, you did this. So that really saved me. So documentation is very important in care sector. Very, very important. So that really saved me. Documentation is the best. Thank you.
Amazing. Do we have non-carers in the group? Do you have non-carers? Do we have people who are intending to be carers? Do we have? Or is I don't think everybody.
Yes.
We have you have non-carers, is it?
Yeah.
Amazing.
Yes.
So I'm sure you guys are paying attention to the advices and recommendations.
Yeah.
Very, very, very important. I would add one more to it, and it's your handover notes. Okay. Your handover. Okay. Pay attention. Get close to somebody who is well experienced in the place, and then ask more about the patient that you are going to take care of. So the handover is very, very, very key, because your handover notes are the ones that could give you a bit more and detailed information about the mood of the patient during the morning. Probably you're a night shift worker, and therefore they will tell you what happened in the morning and what happened in the afternoon. Okay, and that pre-informs you how to go about. Probably the patient doesn't want to talk to anybody on that day. It may be a mental health patient, is very aggressive. Maybe she lost his mother or certain things, and he doesn't want to talk to anyone, and you are not aware of, and you go and do something to protect them. And so your handover notes, do not miss your handover notes, okay, or handover meetings. It is done regularly in the hospitals. Very, very key. It is done also in the care homes or supported living facility. Don't just take things normal routine. So you just come and that's it, because you think you are used to the carer or the service user for a long time. So everything's the same. No, things changes, behavior changes. If it's a mental health sector, we have what we call behavioral charts. For those of you who work in the mental health chat, I think the care homes they also have, okay, where you report, okay, the behavior, changes of behavior. Say it again.
The ABC chart.
Correct. You the care homes may say ABC, but in the mental health, I think they have behavioral charts, okay, where you write these things. But ABC, yes, of course, in the care homes, that's what you have. Very, very important. And so your colleague will be the best person to tell you how this patient was during the morning, okay, whether he was aggressive and whether something happened, So if you don't assume that because you work in a place for a long time and you've been taking care of a particular patient for a long time, so it's always the same. No. You on that particular day, you may get things very wrong, because there may be some changes that you are not aware of, and probably you did not ask your colleague. By law, they're supposed to give you handover, but when you work in a place for a long time, sometimes you become so familiarized with things that you don't even do handover anymore. You understand me? We don't even do handover anymore. And those are very critical things that I want us to take. The handover will really help you all or prevent you from any unforeseen things, because you can get a better understanding of what was happening during the day. Okay, during the day, because there may be issues where the patient has been given allegations of guys touching them, and it may be, and they will not even tell you during the handover. They're supposed to tell you this, that the patient has been given allegation, and that informs you how close you have to get with that particular female patient, because he's given allegations that guys have been touching her, and they are doing investigations, and probably you're not even aware of. Okay, and you may be, sometimes you just be. I've had in the UK, I've had Black people who have gone to prison and all that because if a patient lied and said they touched them or they touched their private part and all that, And it's funny because they know the patient have mental health disorder and all that, but once they make allegations, they don't care. They don't care whether they are mental health disorder. They don't care. They will take the allegations very serious. You know, so we need to understand that the healthcare industry is not easy as we see things. Until problems arises, you won't know. You know, it's not it's not an easy industry because your whole life will be messed up. If they ban you, you can't do nothing in the UK. Everything is concerned about DBS. Everything is about DBS. Okay. You might work in factory and other places, but imagine your potential becoming a nurse and a mental health nurse, or you know, it will be shattered. You can't do nothing. Okay. So it's a good area.
Even in the factory, when you are applying, they ask if you have any police case.
Yeah. Yes, they would ask, but the advantage is that the factories, they don't necessarily, most of them don't do enhanced DBS. You understand me? So you might find your way to work in factory because they only do standard DBS. Normally, when you are banned relative to enhanced DBS and not standard DBS. Do you understand me? Okay. So standard DBS is like security jobs and all that. Those are standard. But enhanced, you can't do anything with it. Even voluntary jobs, you can't do them related to enhanced. And everything is connected. Working with the police force, potential jobs, IT jobs, they all need enhanced DBS and all that. And so, not because of the healthcare sector. So you need to cross-examine yourself, the industry that you find yourself. Okay. In as much as I want to see more and the Afro-Caribbean environment, climbing the professional ladder. You know, I want to see more line managers. I want to see more managers in the care homes. You know, I want to see even directors. There's so many unlimited. The care sector is a sector where you can climb as higher as you want, even to becoming directors. Okay, when you have gotten the necessary requisite experience and the training and the qualification, you know, having your masters in mental health specialty, or even adult nursing, you specialize and getting necessary, you can climb higher and higher and higher. You understand me? But the bottom line, you have to ensure that you always comply with good code of practices and you don't do anything that will put you in trouble, because there's so many allegations, there's so many unfair treatment, there's so many racism, whether we like it or not, people will not like you, allegations amongst even the white, you know. So make sure you do things that comply to law, and that ensures that you are doing the right thing. Okay. All right. So guys, we'll bring our lecture for
Sorry,
today to an
Daniel,
end.
permit me to add this to, make a contribution to what has been said concerning
Who is
handing
speaking,
over.
please?
This is
Who is speaking?
Temitope. It's
Oh,
Temitope.
David, right. That's right.
Yeah. Concerning the handing over, and especially for those of us who work in care home, welfare check immediately handing over is also very, very important. Something happened at my place of work sometimes ago, whereby after the handing over, as usual, it was handed over that a resident is okay, she's settled and calm and the rest, and we assumed that is okay as usual, and we went ahead doing some other things before getting to that particular resident, not knowing that the resident has actually packed up, the resident has died. So it was after the resident is on a 4-hourly checks. So we could not determine when exactly the residents die. So this brings up a lot, it's brought up a lot of investigation, and thankfully something just came up just to clear the case of the neck of the night staffs than that particular day. But I just want to call our attention also to it that immediately after the handing over, we should please do a welfare check of every resident that we are going to attend to for that day, for the shift, I mean.
Splendid, awesome, splendid. You see that in hospitals and even the care homes. You see the nurses going what we call rounds. Okay, once once you've gotten your handover, you need to confirm what you have been told by going to having a check. So if you have done that, you would have known immediately that the patient, on contrary to where you were told that the patient was well and rest, the patient was dead. So you would have realized. But if you go by only with the handover notes and then you don't cross-check what you've been told, you may serve yourself wanting. Because funny as it is, a patient may be very well within the 30 minutes with up. So at the time, probably they might be and leaving shift. Maybe the patient was well, but maybe just after 30 minutes, 20 minutes, the patient has passed on. Okay, so it is important that we, like she said, we do our proper checks beyond the hand, but the handovers are very, very important. And then do our checks to confirm the handovers that we receive from the morning shift worker or the night shift worker or the vice versa. Okay, guys, do you have any other contributions? Any other contributions? Okay, so there's none. Emmanuel, Victor, no contributions, okay? All right, Elizabeth, are you done with your contributions?
No contribution, I'm okay.
That's fine. That's fine. And so I reckon that most of you would have started tackling your assignments, isn't it? Are we together?
Yes, we have.
Okay.
Yeah.
Okay,
I
that's
just
fine.
joined yesterday, and yesterday class was my first class. I don't know how can I access the assignment.
Do you have access to your student model?
Not yet. I just joined yesterday.
But you should have gotten a student model account to be able to log in, because all the recordings will be put in. So contact the back office tomorrow, okay?
All right.
And ask them on student model. You should be. Can I ask a question? Are you able to are you able to access your student model?
Yeah.
Yeah.
Yes.
Good.
Yes.
Okay. So, my friend, what's your name again?
My name is Kudrat.
Yeah, please kindly contact the back office tomorrow. Call them or email and ask that you're not able to access your student model because you need the recordings, okay?
All right. Then another thing I want to ask is what class is today? Is today the first class, second class?
That's the last. Today's the final one.
All right.
Yes, we have one more lecture which is called assignment discussion. The office is supposed to schedule that and send emails to everyone. If they've not done that yet, I'll have to prompt them to do that. But today is the final one. The next one should we have is going to be assignment discussion.
Oh, okay.
Yes,
so you started this class like over a month ago?
No. When did we start? It wasn't a month
About
ago.
2 months ago.
Yes, about 2 months, yeah.
So I don't know, maybe they added me to the wrong class then.
Million.
Yesterday was my
That's
first class.
350 million.
Is that for Stina? Hello. So you need to try to speak to the admin team, okay?
Yeah, I'll speak to them tomorrow.
On Monday, yes. Tomorrow, please.
And they just added me to this class. So maybe by tomorrow they will sort everything out.
Yeah, probably you might need to join some other lectures for the other ones, but you need to speak to them, okay?
Yes, I will.
All right, guys. Lovely meeting you guys once again, and it's an honor. I'm sure 24th of April, I'm going to meet all of you at the graduation ceremony, isn't it?
Hopefully, if we're not that busy, we'll probably come.
Okay, make sure you catch up with assignments, submit them on time. We might have one more lecture, which is assignment discussion. I will try to organize that to the back office, and they will send relevant emails to you guys. Hope to see you on graduation day, so we can take some pictures together. Okay.
Thank you very much for the class today.
All right. Bye. Take care of yourself.
Yeah. Bye.
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 Bye. Bye. Bye.
Bye.
Bye.